So the way we'll proceed is that Mireille will start with a short discussion about the nature of the current COVID-19 crisis and crisis within federal systems more generally. Then I will speak a bit about the approach that we develop in this paper from a theoretical standpoint. Then André will talk about the nature of fiscal federalism in Canada, the nature of our regime, and the main programs that are part of fiscal federalism. And finally, Trevor will put forward some policy recommendations about how we can improve the current system in light of this ongoing crisis. So Mireille, it's all yours.
Merci Daniel et merci à l'équipe de MISC pour la super organisation, and thanks for everyone for being online and bear with us as we're all learning to delivering talks and doing seminar using this new modality. You know, for myself, it's really freaky not to see people, so I expect at least my co-author, because we can't see the people in the audience, so I expect at least my co-author to do some emphatic head nodding just to help me go through. Thank you, André. And so, as Daniel was saying, I'm going to talk more about crisis, and especially more about a concept that I'm working on right now that we had started working on before COVID-19 occurred, but that has still a lot of relevance, I think, for the discussion today. And so we call this concept complex intergovernmental problem. And I want to take maybe a step back to talk about where I'm starting from when talking about this. As some of you may know, in the last 2 months, we have used multiple labels to speak about the pandemic. So we've called it a crisis, a super crisis, a global problem. And obviously there is this kind of like inflation of different labels to talk and to describe the situation we are living in. And while these are all helpful, I personally, my colleagues and I were really interested in speaking about how it is a problem when considering federalism, and especially when considering Canada. So for us, we argue basically, and the paper we wrote also on fiscal federalism build on this, we argue that this pandemic is best described using the concept of complex intergovernmental problem. Now I'm just going to attempt to do screen sharing, so bear with me. It's a highly technological moment of my talk. So as you'll see, this is a concept. I just want to make sure you can see it. There works. Great. So as you'll see, this is a concept that I developed with Robert Schweizer at the University of Toronto, and I invite you to consult our recently open access piece on the topic. It's at the address on the slide, but it's also going to be in the comments if you want to click. So what are complex intergovernmental problems? So complex intergovernmental problems are what we call boundary spanning, irreducible policy problem that unfold within an intergovernmental system. So this concept draws upon studies of intergovernmental relations in Canada, especially on the factors that lead to increase or decrease collaboration. But it's also a concept in which we build largely on insight from public policy, on the typologies of different types of problem, as well as research on multi-level governance. So we define complex intergovernmental problem as distinct from crisis or wicked problems because of their inherent intergovernmental natures and related consequences. And in particular, they have three characteristics that are really important to understand their nature. So the first is that addressing the root causes of these problems is not something that is amendable to government. So basically, governments are stuck with only addressing the consequences of the problem on the territory and within their regulatory space. And that means, especially in federation, that not only do they have to only deal with the problem, but they can only often deal with a really small portion of the consequence of the problem. The second characteristic is that the nature of a complex intergovernmental problem requires a high level of coordination and collaboration amongst implicated government. So responding to consequences not only cannot be done by a single government, but it also demands by nature that every single actor within the governmental system is engaged. And third, these problems challenge existing norms and venues of intergovernmental collaboration. And in our case for this afternoon, also build like the established institution of intergovernmental relations or federalism. So often the novelty of a complex problem requires close collaboration from agencies and governments that have not traditionally worked together. And we can see COVID-19 as being a really prime example of that. They can also create situations where joint interventions are necessary, but the existing mandates, agendas, and processes of IGR or IGR forums are not well suited to coordinate government action. So this is important for us because a novel complex intergovernmental problem can exacerbate poorly functioning aspect of a federal system. And it represents often a stress test that exposes crack in the system. And that failure to effectively respond to the consequences of these problems can also have trickle-down effect on intergovernmental relation in other sectors, including conflict, very open conflict, as well as disengagement from different government. So I'm sure that now you can already have like tiny bubbles in your head or like tiny light bulbs, thinking about how complex intergovernmental or how COVID is a complex intergovernmental problem. I'm just going to quickly raise 3 points. So obviously with COVID, we can see that governments can only deal with the consequences of the pandemic in the short, medium, and long term. We can also see that in our federal system, the consequences cannot be addressed by a single order of government. We can see that both from management of the confinement measure, interprovincial mobility, the supply chain of post-pandemic of mask and other medical supply, as well as the post-pandemic recovery. All of these require deep collaboration by levels of government. We can also see that the problem that COVID creates and the consequences, they do not fit well with established mode of collaboration within the intergovernmental sector. And I mean, we could go for a long time during the question period about how this plays out in public health. For the question of, because of limited time, I'm going to stop here. But in our research, Robert and I have shown that Canada does generally does a good job at kind of creating or responding to the short-term consequences of these type of problems. So operationally, our federal system does great at, sending masks, creating emergency support measures and things like that. But what we've shown looking at other complex intergovernmental problems is that things become more difficult in the medium and long term. Why is that so? So first off, we show that because complex intergovernmental problems challenge norms about the legitimate role and responsibility of different orders of government in a federation. And for a discussion this afternoon, this can mean who should pay and under what condition, right? And these are central to our fiscal arrangement. Another reason is that because interdependency and burden sharing become increasingly salient as we enter into the medium and long-term consequences of complex intergovernmental problem, but that our institutions are not adapted to respond to these new consequences. We show in other work that attempts to adapt these institutions over time become mired with central power struggle and other political dynamics in our federal system. And once again, this is especially the case for fiscal federalism, which and will increasingly be a central point of contention in managing the medium and long-term responses to COVID-19. So just in short and closing, complex intergovernmental problems are somewhat a paradox, right? Because they demand intergovernmental collaboration for effective and legitimate policy response while making the necessary collaboration difficult to achieve. And these problems create barriers to collaboration because they call into question the existing power equilibrium and dominant narrative about how to work together and share responsibility within a given federal system. And as my colleague will discuss, this equilibrium was already precarious when it came to fiscal federalism, and we can see this becoming increasingly of an issue as we move forward. So that's it for me. Thank you.
Merci beaucoup, Mireille. So I will now talk a bit about the the approach that we formulated in this paper to shed light on the impact of this complex and massive intergovernmental problem that is COVID-19. And we start from the institutionalist literature in political science, and a lot has been written over the last 25, 30 years about how institutions tend to be sticky, how they tend to be path dependent, how transformative change doesn't occur very regularly. It's actually the exception rather the rule. Now, some authors have challenged this idea that a transformative change is rare, and they have shown that it can occur gradually. Transformative change can occur gradually over time. At the same time, there is still, I think, a lot of evidence that suggests that what we call critical junctures, specific moment where countries, jurisdictions face massive problems and challenges, that these critical junctures can at least create the conditions under which transformative change, or at least meaningful policy change, becomes possible. So again, the assumption in a lot of the literature is that meaningful, especially transformative change, is relatively rare, but that when you have these exogenous shocks, these massive problems that emerge, then suddenly there is a sense that alternatives that were not considered before become more palatable to policymakers because of the situation, the enormous challenges they face. There is an opening of the possibilities for policy change. And in that context, we understand that economic depressions, energy shocks, or global pandemics, just like world wars, can actually shake up the existing policy regime, the existing system, and increase the autonomy or the potential power of political actors and policymakers more generally to actually revise or even transform the existing policy regime. So if we take fiscal federalism, we know very well in Canada that the Great Depression in the 1930s, the Second World War, were very strong shocks that really helped reshape fiscal federalism in this country. But we also know that when the critical juncture opens, when the possibility for change opens, political actors, decision makers have quite a bit of autonomy in the ways in which they can reshape existing policy legacies, which means that the external shock doesn't necessarily determine the actual outcome in terms of how the policy will change. It just makes change more likely. And so I think the important lesson here is that policymakers have to seize the moment when the critical juncture is opening up. And other authors outside the institutionalist tradition, they talk about a policy window. And that's a term that John W. Kingdom developed. So when the policy window or critical juncture opens up, then there is a sense that a lot of possibilities open for policy change. And there the agency, the autonomy of policymakers is enhanced, and it's their responsibility, or at least their possibility, real possibility to bring about meaningful change. And we think that, although it's very early on, we think that COVID-19 has the potential to create this critical juncture, to open up this policy window. And we are confident that the system that we have, the fiscal federal regime that we have, which already faced challenges before the crisis, is even more vulnerable to attempts at reshaping the system. And this vulnerability, of course, can lead to different policy outcomes, but policymakers have to seize the moment. So now what will happen for the rest of this presentation André will speak about the existing fiscal policy regime that we have in Canada as it exists now and as it existed before the crisis. And then after that, André will let Trevor speak, and Trevor will talk about the policy solutions we think that policymakers today in Canada should explore, should consider in order to meaningful improve, to transform, or at least to reshape our fiscal federal system in this country in light of the ongoing crisis. Donc, André, maintenant, c'est à ton tour de nous parler, pas de nous parler d'amour, mais de nous parler du système de fédéralisme fiscal au Canada. André, it's all yours.
Merci, Daniel. Ouais, c'est pas tout à fait la même chose. Hein? So as Daniel said, I'll discuss the basics of the transfer system in Canada, and then talk a little bit about why, as Mireille said, you know, the equilibrium that we had before the COVID crisis was precarious. So basically, we know that provincial governments in Canada have to provide public services, a substantial number of public services, including in areas that are expensive, such as healthcare and education. So for this reason, we have transfers from the federal government to provincial governments. Now, this system of transfer rests on three main individual transfers. The first one is the Canada Health Transfer, which is an unconditional transfer per capita to provinces, with the idea, of course, that provincial governments use that money to finance healthcare. I mean, it's technically conditional to provinces respecting the Canada Health Act, but I think in comparative perspective, we can say that that's, you know, pretty much very close to an unconditional transfer. The same is true for the Canada Social Transfer, which is enacted to help provincial governments finance such thing as post-secondary education, social assistance, and children's services. That's also mostly unconditional. You only have to, as a province, not require a certain length of residence for citizens to be able to access social assistance. So in a sense, those two transfers are quite unconditional. And of course, the third one is equalization, which is totally unconditional, which works a little bit differently insofar as payments from equalization are made only to provinces whose fiscal capacity fall below an equalization standard. So not all provinces receive equalization payments, whereas all provincial governments do receive the Canada Health Transfer and the Canada Social Transfer. So in terms of size, the Canada Health Transfer is the biggest of the three. It accounts for close to half of the federal transfers. The Canada Social Transfer is about a quarter, and equalization right now about 20%. So that's kind of that's the main structure of the system. Now there's a distinct financing system corresponding to equalization that's applied to the territories, called the territorial formula financing. And of course, the federal government also provides money to provinces for smaller, typically more targeted projects, such as housing, such as infrastructure, right? So we have this system of transfer. Now, there was an equilibrium before the COVID crisis, but like Mireille said, it was a precarious equilibrium for a couple of reasons. The first one is that there were some strong political pressures coming from Western Canada, primarily from Alberta, but also a little bit from Saskatchewan, on the equalization front. What's interesting here is that although the Alberta and the Saskatchewan government were very critical of equalization, their issue was really with pipelines, with what they saw as the slow and weak progress on pipeline expansion to take Alberta oil to foreign markets through the West Coast and the East Coast. So in doing so, they clearly assign blame to specific actors, most importantly, the federal Liberal government, and to certain provinces that were critical of pipeline expansion, but were recipient of equalization, namely Quebec. So there were many different political arguments deployed by the Alberta and Saskatchewan governments to, to question equalization in Canada, or the structure of the program as it is at present. But these criticism were really derived from a frustration stemming from what these two provinces considered slow progress on pipeline expansion. This being said, there were also some more structural issues that were placing the transfer system in somewhat of a precarious equilibrium, and especially the Canada Health Transfer. Of course, provinces typically make the argument that they need stronger financing from the federal government for their healthcare system, who's under a lot of pressure, in part because of population aging. Some provinces also argue that the Canada Health Transfer, which is strictly per capita, is quite blind to the specific situation of different provinces, including the provinces that are struggling particularly intensely with aging. So those questions had started to be asked before the crisis, and we can say the same thing about the Canada Social Transfer to a degree. It's also kind of unable to tackle specific provincial situations. And to compound those effects, of course, we know that there are certain provinces that were facing challenges from out-migrations, resulting in very difficult fiscal situations. We can mention Newfoundland and Labrador probably first and foremost. So in sum, we have this transfer system that's been fairly stable over the last decade. That was before the crisis coming under a certain level of scrutiny. And now I'll let Trevor speak about how the crisis might contribute to potentially transforming the system and how it could potentially be transformed.
Great, thank you. So before diving into what some of the options are that governments should consider to adjust fiscal arrangements in Canada, I think it's important to appreciate the potential scale of the problem. So government budgets are certainly, as we know, under strain from COVID-19. And a lot of that is related to income support measures from the federal government to individuals and businesses to help bridge them through this period of social distancing to help control the spread of the virus. So that rising federal debt gets a lot of attention, but so far, at least certainly in the short term, it is manageable and sustainable. But I think provincial governments are in a more difficult situation. So the most detailed and recent analysis on this from RBC Economics suggests that right now it kind of looks like provincial governments will be borrowing nearly $80 billion in the coming fiscal year, which is about $53 billion more than they borrowed last fiscal year and represents an increase in total provincial debt by about 10% in a single year. So this is a very large fiscal shock to provinces, even though most of the support measures for individuals and businesses are coming from the federal government. So provincial budgets are really under strain on both sides of their budget. So on the revenue side, we see that we're very likely to have much lower income and sales tax revenue flowing into provincial governments. That represents almost kind of roughly half of provincial government revenue. So current projections from the PBO, for example, and others suggest that maybe nominal GDP will decline in Canada by probably about 14% this year. So that directly translates into lower income, lower consumption spending, therefore lower tax revenues to governments. So big pressure on that side of the budget. And then of course, pressure on the spending side of the budget, primarily related to increased healthcare costs and so on. So this is going to add pressure to provincial governments. Some will be able to manage, some In particular, Newfoundland and Labrador currently are having a particularly unique challenge dealing with this shock. And so it's going to lead, I think, to provincial and federal governments thinking about short-term changes to address the crisis this year, and into medium and longer term, deeper reforms to fiscal arrangements in Canada. So I'll begin with the short-term measures. And here we're going to be largely constrained by what the existing arrangements are, constrained by legislation that is currently on the books, and speed would require that if, at most we do small tweaks to those programs. So on the spending side, the federal government since 1970 has a program called the Disaster Financial Assistance Arrangements. And this is a program that aims to provide financial assistance to provinces experiencing costs related to disasters that would otherwise put a very significant burden on provincial governments or on provincial economies beyond what we would reasonably expect them to bear on their own. So to give you a sense of scale of how that program works, it's something that operates on a regular basis for natural disasters, floods, hurricanes, and so on. Provinces must bear on their own the first $3.25 per person in costs. So fairly low. If you're a province of 1 million people, then you pay the first $3.25 million in costs related to the disaster. Then the federal government will pay 50% of the next $6.51 per person, and then 75% of the next $6.51 per person, and then 90% of the costs beyond that. So the federal government, during periods of natural disasters, typically pays an increasing share of the costs associated with those disasters through this program. But the trouble is, pandemic health events are explicitly excluded under the guidelines for this program. So it doesn't cover disasters like the COVID-19 that we're going through, even though this represents something beyond provincial government control. It's certainly a disaster in any kind of meaningful sense of the term. But in legislation, this program does have a great deal of flexibility provided to the minister and the federal cabinet. So basically what they need is for provincial emergencies to be declared, and that is the case in I'm not sure if every province, but most provinces have declared emergencies given COVID-19. And then it requires that the province make a request for assistance to the federal government. And then there's a lot of discretion on the part of the minister to decide what is eligible and what is not. Typically, forgetting the fact that pandemics are explicitly excluded, eligible expenses to natural disasters under this program do include incremental costs for providing emergency medical care, which is really the big cost that we're thinking about with respect to COVID-19. So the federal cabinet does in the short term have the option to consider COVID-19 to be a disaster under this program, and then be able to provide financial assistance to provinces. And to give you a sense of scale, if, and at the moment, we don't really know exactly what the eventual cost is going to be, but if it's something on the order of $250 per capita or so, which is maybe a good guess at the moment, maybe I can talk about sensitivities to that in a bit, then the feds would be providing total support to provincial governments on the order of about $8 billion or 0.4% of GDP. So that's quite a bit of support through this program for provincial governments on the spending side of their budget. I guess for comparison, if we look south of the border, the United States in their COVID relief package has also, for the first time, considered a pandemic to be a major disaster for federal relief. And they provided about $150 billion to US state and local governments, which is about 0.8% of their GDP. So just to give you a sense of scale through that program. But on the revenue side of the provincial budget, where we might potentially see the greatest pressure on governments, where suddenly and significantly, incomes are falling and therefore revenues are falling. There's a pre-existing federal program called the Fiscal Stabilization Program. This is there to provide a kind of insurance buffer to provincial governments whose revenues fall dramatically. This program came into place in 1967, specifically to provide a kind of backstop to provincial governments in periods of severe economic contraction, so deep recessions, for example. So the original program was fairly straightforward. It would provide payments to provinces whose revenues decline by more than 5% between one fiscal year and the next. The program has gone through a lot of changes since then that kind of limits the amount of support that it can give. So I'll turn to those details in a minute, but just to give you a sense of scale, if total income falls in Canada in 2020 by the amount in the PBO's last report of 14%, and if only we think about the drop in income and sales tax revenues to provincial government, then we're looking at revenue declines of potentially as much as $30 billion for this year. And then in addition to that, there's going to be revenue declines elsewhere in the budget. So if we think about the original stabilization program's formula, and we see that, let's say the income tax revenues fall by that 14%, then the provinces bear the first 5% of the fall, and then the feds pick up what happens after that, the rest of it. So just this quick back of the envelope math here, if we look at that 14% reduction, then the stabilization program would pay about 17 billion or so to provinces. So it's potentially quite large, but over the years, the stabilization program has changed in a few meaningful ways, but in 1987, they implemented a cap on how large the cash supports can be to provinces to be no more than $60 per capita. So that would limit direct federal support during this COVID crisis to a little over $2 billion to provincial governments. Beyond that cap, the federal government, under existing legislation, does have the ability to provide interest-free loans to provinces for a period of 5 years. So that can certainly help provincial governments who would otherwise need to borrow on the open market during a period of strain globally. Provinces typically borrow at higher interest rates as well. So that ability for the feds to provide interest-free temporary loans to provinces is there under existing legislation. What Alberta and other provinces have been asking for with respect to this program prior to COVID was for that $60 cap to be, well, Alberta was asking for it to be eliminated, but you can imagine easing that cap to increase the cash transfer portion of the stabilization program. So that would be a way to provide support in the short term. So stabilization on the revenue side, disaster financial assistance on the spending side. But over the medium term, I think thinking about how we can change or improve the way that, for example, health transfers are done. So rising healthcare costs in provinces was already a concern and has been for years because of aging populations, adding to health costs in every province and in lots of countries around the world. And currently the health transfer is just a straight up per capita transfer. So thinking about changes to the health transfer to both increase the pace at which it grows, to keep up with rising healthcare costs because of an aging population, potentially introducing age adjustments to the allocation of health transfers so that provinces with older populations would receive relatively more than provinces with relatively younger populations. So these are changes that may be accelerated because of COVID, and we see that it's in particular a disease that hits older individuals much harder than younger. But beyond health transfer changes, there are lots of other options that can be explored, and it's hard to overstate the federal fiscal capacity in that regard. I mean, the federal government can borrow at significantly lower rates than provinces. The current federal debt level is substantially below many other federal governments around the world at about 30% going into this crisis, although of course that's going to rise because of federal fiscal measures. But the ability of the federal government to increase fiscal supports to provinces is quite large. I think there's obviously trade-offs to consider when rolling out such reforms. You know, things like with the stabilization program, you wouldn't want to create, for example, incentives to provinces to make risky decisions, and in Alberta's case, rely heavily on natural resource revenues. There's lots of trade-offs to consider for sure. But regardless of how fiscal federalism responds or what the specific design details are, I think for the reasons that all of us described today, that this COVID-19 does potentially represent one of these critical junctures that will have lasting implications beyond just the short-term changes that I described in detail today. So I guess I will pass it back to Danielle, and then we can go into some Q&A. So thank you.
Thank you, Trevor. This is really interesting discussion, and we have already at least one question, and maybe we can return to Blair and she will summarize the question for us and then we'll answer it. But I invite people who have questions to actually write them down either in the chat box or the Q&A box, and then we'll answer your questions if you have any. But I know there is already one question, so maybe we can go to you, Blair, to discover what it is.
Sure. So our first question is, policy change in light of an exogenous shock still usually requires the availability of some alternative ideas. So politically, is there an alternate conception of the role of federal transfers in Canadian federalism that would be supportive of a major realignment of fiscal arrangements?
That's a good question. I can start and then let my colleagues answer if they want to add to something about this. I think that there are alternative ideas. Actually, before the crisis, we're already discussing, for example, the possibility of expanding the, maybe even transforming the fiscal stabilization program. As we stand now, I suspect that all the provinces could qualify for this program soon, and the program offers very limited benefits that with a low cap per capita. So I think that before the crisis, this is an idea that was popular in Alberta and Saskatchewan. But if all the provinces will actually, or most of them, receive money in the context of this program soon, it's likely that pressures to rethink or dramatically beef up this program are likely to gain even more consensus. We actually know that premiers, all the premiers before this crisis or this major complex intergovernmental problem emerged, we know that they all supported an expansion of the fiscal stabilization program. Now, I'm not sure what will happen now, but there were already ideas out there in terms of how we could improve the system. Trevor Tombe actually published a piece recently with IRPP on that, how we can improve this program. We have also a lot of ideas out there about how to really beef up and even transform the Canada Health Transfer, not just asking for more money, which the provinces have done, but now we have a discussion about long-term care and its status within healthcare funding. So there are already ideas about also equalization that were debated before, about creating, for example, a standalone independent permanent commission to manage the equalization program, an idea that André and I have been promoting for quite a few years, but also substantive proposals about, for example, taking into account expenditures and issues like demographic aging when calculating transfers, including perhaps equalization. So there's already a lot of ideas available in the kind of institutional repertoire and policy repertoire within Canadian federalism, but new ideas might also emerge in the context of this critical juncture. But there are quite a few ideas that have been articulated in recent years that could take a new life in this context. Anyone wants to add something about this? Maybe Trevor? Or...
Yeah, I guess just jump in with a couple of brief thoughts. I think you did a great job summarizing what ideas are out there already. I think the last time that Canada went through a period where there was such sudden and significant fiscal strain on provincial governments was potentially the Great Depression. And this was an event that did precipitate the formation of a royal commission known as the Rowell-Sirois Commission to take a look at not just federal provincial fiscal arrangements, but lots of division of responsibilities between provincial and federal governments. And it's that commission that led ultimately to, for example, EI moving to the federal government level. So this, may be a moment, and this is, I guess, just me personally, be a moment to think about forming, maybe not a full-on royal commission, but something that can dive in to the details of current arrangements to help inform our decisions around the medium run. So that's also why I like to separate the short and the medium run. In the short term, we do have a lot of tools that can, if we want, be sufficient to provide a lot of support to provincial governments in the short term. And we do have some time and ability to think more rigorously about medium term changes and sift through all the ideas that have been put out there.
Thank you. Maybe we'll André and Mireille can deal with the next question, because we have at least another question or two there. Blair, can you tell?
Yes, we have a few questions here. So we have one that says, the article quite aptly draws attention to the inadequacy of the current CHT, CST, and equalization program for equitable and efficient distribution of federal transfers among provinces, hence the need for the transformative change at this current critical juncture. They were wondering, have the key missing parameters from the existing set of formulas been identified? The attendee points to the rapid growth of aging populations as most likely being one of those parameters. But they're wondering if we could name some other parameters, explain why they're relevant, and if they're being deployed successfully in other jurisdictions.
Thank you, Blair. Who would like to start with this one?
I can start a little bit. I think, obviously, when it comes to CHT, the population aging is the big factor. On equalization, there's been many different debates on different parameters that could be introduced into the formula. And probably the most important is to have some kind of testing of needs to see exactly what it costs to for provinces to deliver public services, right? You could have provinces, again, that have an older population. So that makes the cost of some services higher. You can have provinces that have a high proportion of new immigrants, which also represents some additional costs. You can have a province that has a population that's dispersed, which again increases the cost of delivering public services. So on equalization, there's lots of different parameters that you could introduce in the formula. But as Danielle and I have written in many places, this also is a danger in doing that because there's some level of arbitrary that's introduced to a greater extent in the formula if you need to judge the needs of provinces. But perhaps, and especially if provinces are affected differently by the COVID crisis, this is the type of debate that could resurface. Not that it's ever disappeared, but I think it's a type of debate that we could hear a lot more about, looking for a better, having a deeper dive into provincial situations when it comes to equalization.
Anyone wants to add something about this? So let's move, Blair.
Sure. So we have a question that asks, do you see the federal government providing direct support to cities to shore up their fiscal challenges by sending the funds through the provinces. I mean, someone else that asked about municipalities as well. So if someone wants to talk a bit about the relationship there.
So in our article, we didn't concentrate on municipalities. We do mention them. But there is another paper I've written, a short article that's coming out later this week in both French and English with other co-authors that deals explicitly with the situation of municipalities and the role of fiscal federalism. And also, as Trevor has alluded to, there is, I think, the need for an independent commission on fiscal federalism that will look at not just the feds and the provinces, but municipalities. And I'm part of the steering committee of such an independent commission. And the article that will appear later this week in Policy Options in both French and English will lay out the agenda for that commission. So stay tuned. But certainly, that was a plug. But certainly, I do think that municipalities are essential here, that they are facing a lot of hardship. And often when we talk about fiscal federalism, they are a bit neglected. I think it's because of our constitution and the way it's set up, and this idea that provinces, that the municipalities are just creatures of the provinces, an idea that's being challenged right now. But certainly, in reality, we know that when we talk about federalism, we tend to focus mainly on Ottawa and the provinces, then the territories, and then we talk about municipalities. And I do think that we have to take their plight very seriously, especially now. And COVID-19 is actually also stressing some of their needs. So I don't know who wants to talk a bit more about this. Do you want to start, Trevor, and then Mireille, or
Yeah, I'll jump in here, I guess, just with some context around the magnitude of the challenge for municipalities. So we have heard a lot of concern raised by municipal leaders across the country. And I think going into this current year, prior to COVID, cities in Canada were looking to have about $200 billion or so in revenue. About 1/3 of that comes from property taxes, another third from transfers from provincial governments, and then the rest from the sales of goods and services, transit ridership fares, recreation fees, parking, and so on. And so you're seeing strain on municipal governments because of the drop in use of all sorts of city services, the closure of recreation facilities, park revenues evaporating, and so on. In addition to that, as businesses and individuals go through periods of significant strain, there may be property taxes that are unable to be paid this year, and that's quite large. If there's 10% of property owners who cannot pay their property taxes, then that does represent about $6 billion nationally of foregone revenue. So there is a significant challenge to cities, and if we add that to the back of the envelope $17 billion stabilization payment that I referenced earlier in this webinar, that does then, combined add up to 23 or so billion dollars in total. And if we look to the United States, their support package to state and local governments was that, state and local. It provided, out of the $150 billion, or 0.8% of their GDP, a fraction of it, a fairly large fraction, was earmarked directly for support to localities within states. So that may be, and I think should be, something that the federal government thinks about. If only because the federal government is better able to carry the fiscal burden of a shock of this nature. They can just borrow much more cheaply than provinces can, and much more cheaply than municipalities can. And for many municipalities, the ability to borrow at all to bridge the difference between revenue and spending is also constrained by legislation. So some provinces are, in the very short term, allowing some more flexibility for cities to borrow, but that's really a stopgap in the short term.
Thank you very much. Blair, we move to another question.
So someone is wondering, given that the employment effects are likely to be persistent, how does a universal basic income or universal basic services fit into the mix here?
Well, I think this is an idea that, again, we talk about critical juncture that a lot of people are talking about, both on the left and even the right of the political spectrum. The issue with this type of policy idea is that if you want to set up this minimum income at a meaningful level, it would be extremely expensive. And so there are people who are critical of this idea and say, it's probably better to focus on targeted programs. Like, what are we doing with our social assistance programs right now, you know, which are quite low by international standards, to say the least. So there would be other ways to fight poverty than investing in that type of universal income, guaranteed universal income. So I think you have two sides of this debate here. I saw one of our PhD students at McGill, Olivier Jacques, who published a critical piece on universal income recently in the policy options, and others who push forward for this type of policy. So I think this debate is not over, but certainly the current situation has exacerbated it. But the costs are really a big deterrent here, at least if you want to, you know, raise the bar so high that this minimum income makes a big difference in terms of reducing and preventing poverty.
Yeah, I'll jump in just to add a plug to some fellow academics in Canada. So the British Columbia government in July of 2018 announced the creation of an expert committee to study the potential of a basic income approach to reducing poverty and what that will represent. And I think its work is hopefully going to conclude this year and is almost surely going to reflect at least somewhat on the current situation. It's led by economist David Green at UBC, Reese Kesselman at Simon Fraser University, and my colleague here at the University of Calgary, Professor Lindsay Tedds. So I would, I guess, just plant a flag there to say stay tuned for what's going to be a wealth of detailed analysis around pros and cons and options for a basic income. So I will await their research in order, or before concluding anything either way.
Back to you, Blair.
Okay. How can you design a fiscal stabilization program that would not encourage a province that purposely relies on roller coaster resource revenues and avoids using sensible and stable sales tax revenues?
What a fabulous question. I would love to dive into that. So I'm going to reference actually my paper that I published earlier this year with IRPP, and it's entitled An Overdue Review of Canada's Fiscal Stabilization Program. What this does is tries to answer precisely that question. How would we design an insurance arrangement for provincial revenues that doesn't incentivize provinces to take risky decisions? And this is a challenge that any insurance arrangement faces, known as moral hazard. If you cushion someone from the consequences of their decisions, then they might, at the margin at least, make riskier decisions, increasing the costs of the thing that we're trying to insure. So I pitch kind of two ideas that would go a long way to minimizing, I think, to the extent possible, that moral hazard concern for provinces. So one option is to not insure revenue, but to really harmonize stabilization and the equalization programs to provide a kind of insurance to fiscal capacity, which you could, if you wanted, either partially or fully exclude resource revenues from that calculation. So effectively, you would be cushioning provinces when their tax bases shrink. And you would be evaluating their fiscal capacity like we do with equalization based on some national representative tax system. So if a province like Alberta chooses not to have a sales tax, they would still be evaluated as having the capacity to have sales tax revenue. So that could be done. It would really just be providing for like a rapid response component to equalization, if you will. Another option is to ensure changes in GDP. right? You would be measuring stabilization payments not based on provincial revenue, but based on some measure, some macroeconomic measure. So that would be a much bigger and deeper reform that I think should be thought about a little more before doing. But there are ways of designing insurance arrangements that account for the fact that some provinces choose higher volatility revenue sources.
Thank you. Blair?
Great. So we have a bit more of a forward-facing question. If governments deal usually with consequences, as Mireille discussed, then in which way can they be prepared for future and non-expected and new complex intergovernmental problems?
Thank you. That's a great question, because obviously government face problems all the time. And most of them are unexpected. So then how do we do? So in our paper and in our research, and I think the discussion we're having today as well points to the fact that it's impossible to predict those consequences. But one of the things we can do is be really mindful of the health of our intergovernmental relation and of the overall health of our, and I'm realizing now it's funny because we're talking about pandemics and I'm talking about health, but the overall health of our federal relations. And so what that means in practice, at least from an optics of dealing with complex intergovernmental problems, is to be very open and mindful about capacity and government capacity on 3 levels. So first, on the level to engage with proper discussion when it comes to fiscal arrangement, then capacity when it comes to actual state capacity to implement policies, and perhaps more importantly for us this afternoon, fiscal capacity to meet what is required of each level of government. But that also means, I think, and it goes back to some of the discussions we're having about the role of municipalities for fiscal, for IGR, to have venues in which we can actually have discussions about the nature of new problems and the natures of problems that federations are facing. So one of the issue that we're going to face addressing the fiscal consequences of COVID-19 is, what is it a problem of in the medium and long term, right? Is it a problem of fiscal federalism? Is it a problem of poor provincial management, of resource dependence? Is it a healthcare problem? There's so many ways in which we could define that problem. Each province will want to define it differently. The federal government will want to define it differently. And obviously, as you all know, these problem definitions have major impact. And then, how we think about the solutions and how we think about who should do what. So in previous work, we've shown that building a common understanding of the policy problem and recognizing how it impacts different actors within the federal system is central to kind of finding a way to exit or to address a complex intergovernmental problem. But this can only be done when partners are willing to sit at the same table and kind of talk about it, right? And this can only be done when they have a feeling that entering into this discussion will not have the consequences to limit their capacity to then pursue their core area of jurisdiction. I think that the two other things I would add to answer this question is that in making sure that people can that government can actually build a common understanding of this problem, we need to be mindful of the need to adapt the venues to discuss these problems. So once again, right, thinking about how we're going to debate the future of fiscal federalism in Canada, what is the proper mechanism to do that, right? Is it a commission? Is it through peak IGR venues? And if so, what do we do with cities, right? How do we make sure that we can include them in these discussions in a way that is highly meaningful? And finally, once again, in doing or in preparing to deal with those consequences, we need to be very serious and make sure that governments can be very serious about reassessing constantly the role and action and processes of key actors and resource allocations. And once again here, the question about how we set up accountability measures and how these accountability measures then become important mechanism for proper governance is so important. So obviously we can plan for the future, but what we can do is at least make sure that we're in a good enough place that when these type of problems hit, we have less obstacle to sit at the table and to start to do something, to just start to move into a new direction. Thank you for the question.
Blair?
Sure. Someone is asking about the Federal Reserve in the United States and their lending towards the states, cities, and companies in America. Their question is if you think the Bank of Canada should or may follow the same path.
Yeah, so I'll start there. So the Bank of Canada has actually initiated programs to purchase provincial government debt. So they did that in the short term a number of weeks ago, and I think just starting this month have begun a provincial bond purchase program that, if I'm remembering the amount correctly, $50 billion in provincial government bonds. And so that's something that is quite substantial. It does represent roughly the scale of the incremental provincial debt that we may see being issued over the coming fiscal year. So the Bank of Canada has been there, and I think that has proved critical for certain provinces like Newfoundland and Labrador, that were it not for these kind of measures from the Bank of Canada, they might not have been able to borrow in private credit markets at all. This has always been a power of the Bank of Canada as well, the ability to purchase provincial debt, although it is something that's very rarely used. They typically just buy and sell federal debt. So we are entering new territory in Canada with what's sometimes called quantitative easing from our central bank. And so it'll be, I think, important to keep an eye on it, but they certainly are there supporting provincial bond markets right now.
Blair, we'll go back to you because I think we have quite a few other questions to answer. So we'll try to just be one person to answer per question now.
We do, yeah, we have a very engaged crowd. It's wonderful. So in the examples of medium-term changes that were discussed, tax room transfer was not included. Is that because it is viewed as less feasible in this situation, or less desirable than transfer expansion? Or was it just the space of the short paper that you had to leave it out?
So that's a great question. I mean, in the paper, certainly there is some pretty tight constraints, but tax point transfers is historically a way in which the federal government has transferred fiscal resources to provincial governments. And it made more sense, I think, historically than it does today. We have provincial and federal governments that do have shared tax bases, but they don't set tax rates jointly. So provinces can choose their own income tax rates and brackets, and they can choose their own sales tax rates, and the feds can do the same. So a tax point transfer is really just a coordinated decrease in a tax rate federally, followed by an increase in that same tax rate provincially. But there's no mechanism that can constrain one level of government to the tax rate change by another. So I turn to the most recent sales tax transfer that Canada did, and that was Stephen Harper's GST reduction from 7% to 5%. It was never sold as a tax point transfer, but the feds lowered their sales tax rates from 7 to 5. Many provinces increased theirs by a similar amount, although at different times. So if we look at Newfoundland and Labrador, Nova Scotia, New Brunswick, Quebec, their combined sales tax rate today is the same as what it was prior to the Harper GST reduction. So any province, if they want, can move into that 2-point GST space. And so in that sense, I'm not sure that tax point transfers are something that we should bring back into the fiscal arrangements. So we phased them out almost completely in 2014 when we turned the health transfer into a pure per capita transfer. I don't know if others have thoughts about tax point transfers and the political dimension there.
You want to add something, André?
Well, I just want to add that I think Trevor's explanation was really enlightening, because I think at the level of political discourse, certainly in Quebec, right, there's a sense that this involves increased autonomy, right? But as Trevor explained, it's really one level reducing and the other like increasing. So I think maybe at the level of political discourse, that's something that we will hear, but in terms of the effectiveness of that kind of solution, right? It just, kind of leaves the citizen presumably leaving, paying the same tax rate. So I think there's a big discrepancy here behind the politics of tax point discourse and tax point as an option for fiscal federalism reform.
Okay, well, I said we'll only be one to answer per question, but then I nudged André to answer, but I thought it would be interesting to have a kind of more political perspective added to this. Yeah, Blair.
Okay, so we have a question about the intergovernmental instruments that do exist and those that could be imagined, which could restructure fiscal federalism. Here we have a sense that the feds maybe have all the cards in terms of fiscal imbalance, spending pattern, decision-making. Is that an incorrect assumption?
I'll take it. Maybe I think just quickly, I think that's a very correct assumption. I think when it comes to fiscal federalism, the federal government does have all the cards. Equalization, of course, is a federal program. The other two main transfers are really can be decided unilaterally by the federal government, right? If the federal government wants to consult provinces, it can, of course, it can do that for all kinds of reasons, including political. But at the end of the day, the nature, the structure of the arrangements is entirely decided by the federal government, right? So that's why it's always can be a bit misleading to talk about centralization, decentralization when it comes to fiscal federalism. There's different ways to measure that. But one thing that we do have to keep in mind is that at the end of the day, it's the federal government that decides how quote unquote decentralized fiscal federalism will be.
And I think people remember the 1995 budget, especially people in the provinces who were there at the time. So I think that's a very important remark, but we should also keep in mind that the provinces, the territories, and perhaps the municipalities can unite and try to pressure the federal government. But in the end, the federal government, I think, holds the bigger end of the stick, right? So we have to keep that in mind. But I think that it's very much a political issue. And we'll see how things evolve over time. But I think that André's answer is really spot on. Blair.
Okay. With these debates about fiscal federalism being an inevitable outcome of the pandemic crisis, should we foresee an eventual debate about the need to redefine Canadian Confederation, i.e. federal government versus provincial government versus municipal government?
That's a question for Mireille.
Goodness, that's a really big question. I think the question I don't like webinars. So thank you. I think that I don't foresee, and unless I'm mistaken, I will open it to my panelists after. But I don't foresee a major kind of popular support for such a redefinement or opening of those core questions, especially in a period like right now. So I think that the question is interesting because it points to the central points of tension within our existing institutional regime. But I think it would be highly unlikely that core changes that would reimagine the respective role of government almost at a constitutional level is something that we can expect to see coming out of this crisis. But if any of my panelists disagrees with me, please, by all means, speak.
I agree with you.
I'll take it quickly. I agree with Mireille. I think that there are, I mean, we know that, again, in times of crisis, there's, the federal government has a sense for a greater role, right? We know that. But at the same time, we also know that in the Canadian Federation, there are very strong societal and political forces that support a strong defense of autonomy. So again, there is a kind of precarious equilibrium there, and I'm not sure that this crisis will fundamentally alter that. Right? I'm not sure that. In fact, I'm sure that provinces are not willing to let the federal government acquire that big of a role in Canadian society. And honestly, I'm not entirely sure that the federal government is also ready to wage that battle, because it would be a battle. So I think I agree with Mireille.
So Blair, maybe we can collect some questions, because I think there are quite a few. So maybe we can end with the big fireworks, so you can ask us the remaining question or summarize them. And then we'll try as a group, one after the other, to answer the questions we can answer, so that we cannot, spend so much time on one question at a time. Is it fine, Blair?
Yeah, sure. I think we're close to the end anyway. I wanted to end on a bit of a bigger picture question that I think everyone could answer. How do we conceptualize long-term societal well-being and saving priorities when we might be facing a drastically different reality in the coming century? More natural disasters, when everything is such an exceptional case now, when we have to think about consequences rather than preparation. Going forward, how do we conceptualize that, do you think?
Maybe I can start, so that way I'm not scooped, but joke aside, I think that the first thing to do, while we cannot fundamentally change the way our federal system function, what we can do is to rethink the way we address interdependency and the need for government to develop new areas of collaboration that reinforce the capacity of each level of government within such an interdependent set of consequences. And I think that, I think that federalism has always been based on this idea of interdependencies, but the type of problems we're facing now just increase that tremendously. So what kind of institution, what kind of fiscal mechanism do we need to establish in order to reinforce each level of government or each order of government's capacity to address that and to engage with those interdependencies would be, for me, the priority in terms of moving forward.
I would add and highlight that I think going forward, I think the question is exactly right. We need to think more about resilience and volatility in the arrangements that we design. Certainly seeing increasing frequency and severity of natural disasters. That's something that you can see in the disaster financial assistance program that I discussed earlier. And that has recently motivated changes to that program to provide financial support federally for certain types of mitigation initiatives by provinces to better prepare and to have infrastructure that's not as susceptible to costs incurred from destruction from natural disasters. So thinking about that more broadly, thinking about increasing measures of this kind. And then economically, we're seeing also not more volatility economically overall, but we are seeing much greater levels of differences in economic growth rates across provinces. So Canada today has much more disconnected economic ups and downs, if you will, than it historically has seen. And so thinking about arrangements that are robust to that increasing feature of the Canadian economy is quite important. Then for provincial governments themselves to ensure that the decisions that they take are prepared for that volatility. Because I think going through this, coming from an Alberta perspective, I see that the world is giving us enough risks and shocks to deal with that we don't need to add to that our own kind of self-imposed risk and volatility from, for example, here relying so heavily on resource royalties. So I hope we give a lot more thought to resilience and volatility in the policies that we enact and the arrangements that we roll out in the future.
Claire?
Okay, we had two more that came in under the wire, so I'll put them both out there and we can address them both. Someone wants to know that we talked about federal, provincial, and municipal governments, but there hasn't been much discussion about the relationship between First Nations and Métis and Inuit governments. We also have a question about areas that fall squarely within federal jurisdiction, communications, transportation, or others where there is an established role, in which you might argue that the federal government could play a more active role than it has in the past few decades in order to step up during these times.
Thanks. I will just comment on the first question and someone can think about answering the second one, or we want to add something about the first one. It's true that in the paper, we didn't talk about Indigenous issues as they intersect with fiscal federalism. I think it's a very important issue, but it's broader than just fiscal federalism, the traditional sense of the term. It's about self-government. It's about reconciliation. It's about a host of really important issues. But I do think that in order to move forward in terms of self-government and reconciliation, Indigenous communities must have the fiscal capacity to build themselves. Well, first of all, to generate and extract revenues, but also need to have the assistance that they deserve in order to bring about economic development and address social and economic problems that they face. So I think this is something that should become part of the kind of mainstream discussion about fiscal federalism, although often we put that a bit aside because it's so broad and it deals with so many other issues. We tend to isolate that a bit from the debate about fiscal federalism, but I absolutely think that this is a question that needs to be addressed. When we talk about self-government and reconciliation, the fiscal side of this is absolutely crucial. Who wants to address the second question? Trevor?
Can you repeat the second question?
Yeah, I was just calling that. Are there areas that fall squarely within federal jurisdiction or others where the federal jurisdiction has an established role, such as post-secondary education, communications, transportation, in which you might argue that they could play a more active role in the next coming time?
Yeah, I mean, what would top the list for me is healthcare. This is something where it's entirely provincial, but we're seeing something of this kind of health shock is not something that respects provincial borders or even national borders for that matter. So there may be a role for the federal government to at least provide a lot of the funding support for stockpiles in the future, for testing and tracing infrastructure and so on, things that really support provincial healthcare systems, but in a way that really addresses what I think of as this externality that exists across provinces. And so that would be certainly the kind of scale of testing and tracing that some are thinking about being needed in the future, the scale of certain stockpiles that we might, I think, accumulate in the future to prepare for very rare but very large shocks of this kind will be quite costly. And that's something where I think the federal government's pretty well placed to play a role.
And I will add that in general, I think that the federal government will have to increase the Canada Health transfer through other ways to give more money to the provinces regarding long-term care, healthcare more generally, preparedness, emergency issues, but also healthcare in general. The premiers have been asking for more money already, and I think that their ask now is more legitimate than ever considering the current situation. Well, Blair, do we have any questions left?
I think that pretty much covers it for us today. Thank you for everyone's questions. They were wonderful.
Thank you for all the wonderful questions. Thank you, Blair, for your moderation and technical support. We are not that technologically savvy. I'm not, and I think it went quite well, apart from me not turning on the microphone the very first time around. But apart from that, I think it went well. This is our first webinar, but not the last. We'll organize more webinars in the future. I'm already thinking about a webinar next month, perhaps on long-term care. So stay tuned and go to follow us on Twitter, Facebook. I want to thank my wonderful colleagues, of course, André Lecours, Mireille Paquet, and Trevor Tombe. Merci beaucoup pour votre attention. Et vous pouvez consulter notre site web et aussi sur les médias sociaux, Twitter, Facebook. Suivez nos activités. On a aussi un site web bilingue. Et on espère vous revoir bientôt sur Internet et un jour, j'espère, en personne. Thank you very much. Stay safe and take care.